Colon cancer is the second most common cause of cancer deaths in the U.S. when numbers for men and women are combined. That's according to the American Cancer Society. A new study found that Black patients are more likely to need emergency colon cancer surgery compared to their white peers. I spoke with a doctor at Novant Health about what this study means and how triad agencies are working to address this disparity.
And what we see is that it is hard for people to have access to care, to get colonoscopies when they're recommended.
Dr. David Hiller is a colorectal surgeon at Novant Health. He says there are several factors that eventually cause some patients to undergo emergency surgery for colorectal cancer.
Sometimes it can be misleading information or thinking it's just hemorrhoids, this bleeding that I'm seeing, or I'll get to the doctor, but then you don't.
A recent study in the Annals of Surgery found Black patients are more likely to get emergency colorectal cancer surgery than other races and ethnicities. Dr. Hiller says the research found the disparity was not simply genetics.
When they broke that down further, they also saw similar differences in insurance status and access to care. In their results, in their conclusion, they postulated, well, this is probably an access to care issue. And how can we improve that? And this is kind of backed up in older studies that have shown the same thing before.
Dr. Hiller says there are several triad groups, including Novant Health, working to break down barriers to get colorectal screenings, a tool that can be the difference between life and death.
The Novant Health Foundation has a grant right now to provide free colonoscopies for patients who are in need for this exact reason. And we've been able to provide a lot of really good services and help get people screened, help make sure people are getting to the doctor, that follow up and getting good information.
Dr. Hiller says there are more ways others can help provide more access to screening in our community. This includes the Get Your Rear in Gear 5K, which will happen in March at Jamison Park in Winston-Salem. He says last year the race raised over $70,000 for screenings, education, and prevention in triad communities.